So yeah, I'm Jennifer, and as Yoga said, the IR manager for Advocate Health. And today I'm going to be talking about an expansion project that we have been working on, or I've been working on for our IR theme from yesterday, along with Karen Hannes, our library director. So a little bit of background. In 2022, Advocate, I'm going to be throwing out a whole bunch of names and we reuse names. It's very confusing, but I'll do my best. Advocate Aurora Health in Wisconsin and Illinois combined with Atrium Health in North Carolina and Georgia with the Wake Forest School of Medicine as our academic core. The combined organization called Advocate Health includes multiple legacy libraries, with one library serving the Advocate Health Midwest region, also known as Legacy Advocate Aurora Health, and that's us, the library I'm with, and 4 other libraries serving different markets and educational schools in the Advocate Health Southeast region. And the Midwest region has had an institutional repository known as SHARE since 2014 in our Wisconsin market, which was then known as Aurora Healthcare. It collects scholarly activity for all Midwest teammates, including but not limited to journal articles, books and book chapters, conference abstracts, conference posters and presentations, and we also have archival material from our legacy hospitals, such as photographs, newsletters, annual reports, and so on. There were no other institutional repositories in the enterprise at the time of our combination. So SHARE's primary stakeholder groups include nursing research, graduate medical education, and the Advocate Aurora Research Institute. And when Aurora Healthcare combined with Advocate Healthcare to become Advocate Aurora Health in 2018, nursing research was one of the main driving forces behind the repository's expansion from Wisconsin to then include Illinois. Nursing research wanted to start including Illinois nursing content from their annual Nursing Research and Professional Development Conference, so we expanded to make that possible. Nursing leadership at Advocate Health values the collection of the scholarly activity of their nurses, and they attempt to capture this activity through an internal Microsoft form called WINS, which stands for Works in Nursing. And it's completely driven by submissions, and the data captured is used for internal reporting and nurse recognition, as well as magnet recognition program reporting as needed. But obviously, as a Microsoft form, it's just for internal use. So inclusion of nursing content in SHARE is able to provide some things that the internal WINS database cannot. So beginning in 2020, when nurses submitted works to WINS, they were invited to also submit their content to SHARE with an explanation of the potential benefits of doing so. We found that often bedside nurses interested in research are doing quality improvement projects within their hospital that don't go on to be published. So inclusion in SHARE allows them to disseminate their work beyond their original audience. And also, we've had an uptick in nurses and others at our institution embedding QR codes in their physical posters that will then link back to SHARE. Ahead of time, they'll get those printed, so then conference attendees can view and share the poster after the event has ended. And nurses receive monthly readership reports from Digital Commons, which helps demonstrate the reach and impact of their work, and also opens the opportunity for collaboration with nurses both within and outside of Advocate Health. So we've heard from nurses that this is meaningful to them and that it helps them feel like their work is being seen by others and making an impact. Thanks to SHARE, nursing research leadership is able to see impact metrics from dashboards such as download counts, citation counts, news mentions, and social media shares and likes. So some of the themes that have been coming up at this conference that I think really tie in with what we're doing is, collaboration and trust, and we really have a history of that with our nursing research program and our repository. So all of this history means that we weren't exactly surprised when nursing research leaders came to us with a request to expand the scope of SHARE once our next combination with Atrium in the Southeast came to happen. So ever since that combination happened in 2022, departments and service lines within the organization have been integrating and expanding at different paces. And probably not a surprise to people here, but the library libraries are very complex, and so we are definitely not as far along as nursing in this process. And the nursing service line really prioritized that collaboration across the enterprise. And we already know that their leadership valued showcasing the scholarship from nurses. So nursing research leaders came to us last year in the Midwest asking us to expand that scope of SHARE to include nurses in the Southeast region. And their goal was to keep nursing scholarly activity on the same platform. They're operating as a unified service line across the entire enterprise, and so they didn't want to keep it separate by divisions or start a new IR specifically for the Southeast region, and that's what they did with their internal WINS database. So just to keep it as one that's open to everyone, so it made sense to do it with SHARE as well. And our expansion process has involved the following so far. Digital Commons, we worked with them and based the cost of the expansion. They had us go back and kind of figure out the estimate of the amount of storage that we would require. So, what we thought for number of PDF files and stream videos and content like that. And then because the libraries are not unified, we don't have a centralized library budget. And so there's really no way for the library to absorb an increased cost. Fortunately, nursing really was pushing this project and they agreed to fund their portion of that expanded contract. Otherwise, it wouldn't have been possible at that time. So as of December 1st, 2025, the Midwest Library worked with Elsevier and our own legal department to secure an amendment of our Digital Commons agreement. And this process took several months to finalize, which is really common in our hospital environment, just lots of waiting on legal, and it's pretty painful, but we got through it. And when we expanded to include Illinois content in 2020, I just want to talk a little bit about some metadata changes that were required. So we worked in 2020 when we worked with Digital Commons to add a custom metadata field to capture the state the work originated in. So originally it was just Wisconsin, Illinois, or both if there was collaboration between the two states. And no stakeholders at that time were asking for this information, but we anticipated that, they might want to ask for it in the future, and we really didn't want to have to try to figure that out afterwards by, where the people were based. So it's really proven very helpful in many reports since then. So a little background, I showed a map earlier, but within Advocate Health, we are broken up into different geographic regions. So there's the Illinois division, the Wisconsin division, and then North Carolina and Georgia division are one division. So Illinois and Wisconsin together comprise that Midwest region, and then the North Carolina-Georgia division is also known as the Southeast region. So expanding to the Southeast region meant that the options in this field would need to be updated. We changed the field title to division to reflect that new language that the enterprise organization was using, and to maintain the integrity of our metadata for this field and make it easier on ourselves, we tried to keep as many of the selections the same as we could. I was kind of thinking about it the last presentation, talking about naming schemas and things like that. I think with custom metadata, you really want to think like, you know, what, for us especially, it's just like, this probably isn't our last rodeo as far as like combining and changing names and all this stuff. So trying to stay as nimble as possible and think in the future, like how are we going to be able to do this if we have to change it yet again, and maintain the integrity of data that we already have. So we tried to keep as many selections the same as we could. So Wisconsin and Illinois stayed the same. We added new options for, you know, North Carolina and Georgia. That's pretty easy. Also a new enterprise for all 3 divisions as more collaboration occurs between the different divisions. So the only selection that required retroactive updating was the both option, which was now going to have to be both Illinois and Wisconsin divisions. So before having our wonderful consultant, Sophia, apply the changes, I ran a content inventory report to see how many records would need to be updated. And fortunately, it was only about 100 because that collaboration between Wisconsin and Illinois has been on the increase, but it wasn't a huge number. So after the changes were made, we did go through and do batch revisions for those items to change them to the new value. And I think it ended up being about 15 batch revisions, so it was pretty manageable. So we do expect and hope that other customer segments will eventually follow. So our plan right now is a stepwise approach to expansion. There has been voiced interest from various stakeholders as well as other groups such as pharmacy and graduate medical education. So we're also looking at this as an opportunity for our disparate libraries to collaborate on a project. We really have been challenged with that so far because all of our resources and budgets are still separate. So we see this as an opportunity, hopefully, that we can have something to unify and work towards together. Leakage is one way we expect for interest to grow organically. We saw it in 2024 when we added Southeast nursing content for that nursing research conference I mentioned earlier. Our GME programs also have an annual scientific day that's probably going to start having Southeast co-presenters as more collaboration happens with that Wake Forest School of Medicine. And as this cross-site collaboration occurs, there's increasing numbers of Southeast teammates that will begin receiving readership reports as well. And we've already seen this. Some people are getting those and they're like, what's this? And we can kind of educate them, and then they want to have more content added. So we kind of have to navigate that as it happens and see if they're, eligible at this point, or if they're just voicing interest, and we can add that to kind of our list of possible future expansions. So we've already experienced funding challenges because the funding flow model is not yet established. And since nursing was able to accommodate the cost of that expansion, that's great. But we know this isn't going to be feasible for all departments. So we're also concerned that, the stepwise or piecemeal approach could result in a higher overall cost than a full expansion. So because nursing took the lead by pushing for this expansion and funding it, we've been out of the loop when it comes to knowing how they're exactly promoting it. They're like, don't worry, we'll take care of it. But it's been pretty slow as far as uptake. So we're kind of thinking this year we really need to start pushing from our end to try to make sure that, you know, people know about it. And this isn't an uncommon phenomenon. There's that kind of snowball effect I've heard other people talking about where, you know, we know we're going to hit like a critical mass, but we're just not there yet. And we just need to get more buy-in, and so it will happen. And we anticipate our collection strategy is going to be stifled by that piecemeal approach. So right here you can see we use PubMed harvesting very heavily, and we just really can't rely on that with nurses in the Southeast because it would be way too much manual sifting of like who's a nurse and who, you know. So we're not doing that. So really, it's going to be driven by submissions at this point, so they're just not going to have as robust as Midwest nurses because of that. And, you know, we're going to also have to figure out staffing as far as right now we can definitely manage it, but as it grows, we're probably going to have to loop in more colleagues in the Southeast in the library to do some of that work. And just my takeaways. You know, at least in our health system, nursing, I feel like is very nimble and like very on board with, you know, pushing forward and doing new things. So it really pays to align closely with them in the library. I mentioned, you know, being intentional with that custom metadata, and a lesson we learned is, you know, go into those expansion projects with clear goals and responsibilities so that, you know if there's multiple departments involved, like who's doing what, because we're having some issues with that marketing piece. And that is my presentation, and I know we're speeding through, but feel free to contact me during today, and I can answer questions.